digital health most wired survey data is a crucial resource for us for benchmarking our organization's IT capabilities year over year. I mean, when you think of it as kind of a resource that we're using year over year to identify any gaps in our digital health strategies and prioritize initiatives that can enhance our services for our patients.
I think once you kind of look at the survey, it's not so much that, hey, we're great, the celebration is great as an acknowledgement. I think it's actually some of those areas where you're like, hey, where did we not perform as high? That allows us in the discussion with our technology team, but also that makes its way into our clinical spaces as well, because a lot of those measures aren't just a measure of, do you have technology to do it? It's how are you applying technology to make a clinical area better, whether it's lab or diagnostics or clinical care. All those things are really a representation of how well is your technology geared to making those clinical processes better.
Everyone was talking about digital transformation and innovation, but you can't do that if your systems are failing, if you've got gaps and security issues and all kinds of things. And most healthcare IT organizations I know, especially coming out of the pandemic, had those kinds of challenges. You know, I come back to the most wired infrastructure or the framework of it, because they tie together nicely, because then it's like, okay, so now you've shored things up and you're ready to go. Where do you go? Where do you need to take that next step?
I think we've been a part of the program. We've either had it 19 or 20 times, because that's really what established the basis for us and how we used it. We were ready for COVID before it got here, because we'd already had the initiatives, the strategy and the initiatives in place and underway. And I believe most wired helped influence that.
Remote patient monitoring, that was something that we looked at our data and we saw that we had some opportunities and that Novant Health really needed to take advantage of as it related to remote patient monitoring. And so we actually made a significant investment in wearable technology, mobile health applications, and we were able to stand up a hospital at home program. And this actually allowed for our patients that are the lowest acuity to return home while still being supervised by medical professionals as if they were still in the facility itself. We've seen that less than 1% of those patients have been readmitted in those first 3 days. And in addition, the patient satisfaction score for this actual program is 100%. And that just highlights the fact that that is something that our patients wanted, that we didn't necessarily know that. But by reviewing those survey results, we were able to gain some insight into, this is what other organizations are doing and they're seeing benefits from it. And then as we did the same thing, it just highlights how technology can be leveraged to create that remarkable patient experience.